2021 documentation guidelines are moving into other types and places of service, it's time to start taking a deep dive. Hi, I'm Shannon DeConda with NAMUS. So as we are looking at the 2023 revisions of 2021 documentation guidelines, a lot of our takes are going to start looking at some of these revisions and how they apply to these different types and places of service. So what I wanted to do was start looking at some of the implementations that have changed. So there was two major new adaptations in the guidelines in column 1, specifically to help with inpatient places of service. And if you can see this, there were two new, I highlighted them here for you, definitions that were added, and this is on page 15 of the 2023 revisions to 2021 documentation guidelines. And if you have not downloaded those yet, or maybe you've lost your placeholder, you can find those on our website. We have a dedicated web page for 2021 documentation guidelines. So the term I'm going to use here, and I apologize that I am going to read this, it is acute uncomplicated illness or injury requiring hospital inpatient or observation level care. So that's the new definition that's been applied, and it does fall under the low level on your MDM chart. So therefore, there is going to need to be a revision to the MDM chart. And if you look inside your 2023 revisions, you'll see that the MDM chart has been revised. They've just not released a new pretty version yet. But it does fall under our low level, under our column 1, okay? And again, the definition is an acute, uncomplicated illness or injury requiring hospital inpatient admission or observation. And then it gives a more thorough definition. And the definition is a recent or new short-term problem with low risk of morbidity for which treatment is required. There is little to no risk of mortality with treatment. Full recovery without functional impairment is expected. The treatment required is delivered in a hospital setting, okay? So that's pretty easy, very straightforward. However, I want to break it down just a little bit more. A new short-term problem with low risk of morbidity for which treatment is required. So it's a short-term problem and there is low risk of morbidity. Now, I want to stop right there. One of the new things that I'm trying to get people to understand is AMA's definition of morbidity. We think of morbidity and we automatically think of things we shouldn't think of. It is not just the absolute end of life fiasco that we think of. Listen to the definition of morbidity per the AMA. It is a state of illness or functional impairment that is expected to be of substantial duration, during which function is limited, quality of life is impaired, or there is organ damage that may be transient. That is on page 18. So it's also functional impairment that impacts quality of life. So it's not just it's quality of life, not just end of life. So again, when we read this, it says it is a recent new short-term problem with low risk for which treatment is considered. There is little to no risk that it's going to impact the quality of life without functional impairment expected. So again, this is a very low risk problem to the patient. The patient is expected to have full recovery, so that's why it falls under the low complexity category. So I hope that's helpful in explaining one of the new definitions according to the AMA's revisions. And next time on our next take, we'll review some of our other changes and revisions for the new 2023 revisions to the 2021 guidelines. Again, if you have any questions, comments, need some additional training, please don't hesitate to let us know. And with that, I'll sign off for today.